So where would the incision go?
So why don't I show you on this diagram. So when we do a small or a short incision facelift, I make the incision just in front of the temporal hair because I don't want that hairline to move. So essentially we're going to pull the skin to the incision. If I were to make the incision up in the hair, then I'd be pulling the skin and the hair to the incision, and then that hairline would move, and I don't think that looks good. So the incision goes in front here, just in front of the ear and then around the earlobe. It allows me to elevate the skin that you see in pink. That skin is then pulled and trimmed. It also allows me to access the underlying muscles and tighten them, and that's the important part of a modern facelift. Now in your case, you can imagine that elevating that skin is going to certainly help with your jawline, but I don't think you're going to get as much of an improvement in your neck. So what I'd like to do is actually what's called a full incision lift, where I'll extend the incision back behind the ear into the hairline back here. That's going to allow me to elevate all of this skin as well and then pull all of that up. So you can kind of see that there's a different sort of angle that we're going to be pulling the skin for the jawline versus for the neck. Now there's pros and cons to this. The downside to having that incision back there is that when you wear a ponytail, or especially if you wear it very tight, it's possible that you may see that incision. If you're not the kind of person that wears ponytails very often, I don't think there's really any downside to that incision at all.
Would the incisions be a different color than the color that I have now on my skin?
You know, the color of the incisions as they're healing is usually dark, or at least red, if you have darker skin like yourself. You're from Mexico,
yeah,
and you have a little bit darker skin than some of our European patients. So I would expect your incisions to be a little bit red, and you may want to camouflage that for the first little while. Usually the color goes and starts to blend with the rest of your skin over a period of 6 to 12 months.
When can I start like walking or swimming, doing exercise?
You know, I would say that after a week, you certainly can start going for walks and getting some light activity. Something like swimming where you may be turning your head from side to side, I would say probably a few weeks before you're going to want to do that. It's perfectly fine to get the incisions wet. You can take a shower and wash your hair just within a couple of days of the surgery. That's fine. But I think something that's as strenuous as swimming, I probably would wait for a few weeks.
So what do we think about Lizett? Is she a good candidate for the facelift surgery?
She is, actually. Lizett has some age-related changes to her jawline and neckline, and these are corrected very well with a facelift. In addition, I do think she needs to have some augmentation of her chin, so we're going to put a small chin implant in there. What that does is it brings the chin forward and essentially elongates the horizontal part of her neck, and that's going to make her neck look much tighter. It also provides the structure for me to really suspend the muscles and skin that have become lax along her jawline from something a little bit more substantial. So what we'll see on her profile view is that her chin lines up much more nicely with her forehead. She's otherwise very healthy and very realistic about expectations.